Post-COVID era, you might have noticed more and more young people coming with hip pain. Don't neglect this hip pain in young individuals. So when you present with pain in the hip, increasing stiffness and difficulty in walking, it has to be thoroughly evaluated. The first line of investigation which we do in these patients is a plain X-ray. Most of the time in early stages, avascular necrosis of the hip or the AVN, you would not see anything in the X-ray. So we get an MRI scan. And if in early stages, if it is identified, then the main treatment is going to be just simple medical management and physical therapy. But this avascular necrosis of the hip or the AVN goes in stages. In stage 2 and 3, we might need to offer minimally invasive surgical procedures wherein we do something called a core decompression and supplemented with stem cell management where do an attempt to regenerate the lost bone. And most of the time, in 75 to 85% of the time, this is successful. But if it goes into an advanced stage or the stage 4 and further, where there is also collapse of the head of the femur within the socket, in which case then we have to offer a much bigger surgeries like a total hip replacement. So don't neglect hip pain in younger patients, especially who have had COVID symptoms and who are on steroid management. The earlier we identify this, the management would be much easier and we can get back to them without any surgery.